name is Caitlin. I'm going to be your student nurse today. How you doing? Good? Okay, as I'm walking in, I'm doing a safety assessment. I'm looking for any cords that I can trip on, seeing if my patient looks agitated, if there's anything else that could be dangerous. I don't see anything at this time. My patient's mood looks fine. She has a normal affect, everything. She looks happy and responsive. So I'm going to go ahead and start off. I'm going to just double check, make sure we've got the right patient, just so I don't have to do this later on for the other things I'll be doing. Glenda, can you tell me your first and last name and date of birth? Perfect, that's what I have. Good job. Do you have any allergies? Nope. Okay, perfect. So today we're going to start off by doing a baseline assessment, and then we'll get you some of your meds, and then do a catheter, okay? Do you have any questions about any of those things? Nope. Okay, we'll go ahead and start by providing privacy. And then we'll go ahead and start with our assessment. I'm going to perform hand hygiene. I've already done my vitals, so I have those already written down and documented. Glenda, how are you feeling today? Not super great? That's not good. Well, we'll just go through and we're going to be looking at all of your systems and just make sure that everything's looking okay. Just ripped my glove. Alright, you said you don't have any allergies. Do you have any allergies to anything that's not medications? Nope. Are you on any medications right now? Just the ones that we're giving you. Okay. Do you have any other medical history we need to know about? Any surgeries or anything else? Nope. Okay. We'll go ahead and start with our top and we'll work our way down. I'm going to assess your head. Tell me if you feel any pain anywhere, okay? No pain through the head. Awesome. We'll go ahead and look in your eyes. Look right here at my nose. Do you know what today's date is? Perfect. Can you tell me where you are right now? And who's the president? So my patient is alert and oriented. Her eyes look good. I'm looking at neurological. I don't see any slurred speech, facial drooping. Everything looks normal there. I'm looking in her nose, her mouth, and her ears. And nothing looks abnormal there. Did you have any pain as I was doing any of that? Nope, perfect. Go ahead and come down here. Any pain through here? Okay, I'm going to check Turger. Besides being a mannequin, it's great. We'll go ahead and listen to heart and lung sounds. Can you tell me if you've had any chest pain recently? No? I know you've had a cough, but have you had anything else going on with your lungs? Any pain while coughing or anything else? No? Okay, perfect. I'm just going to listen to your heart sounds. I'm going to listen to aortic, pulmonic, Burbs point, tricuspid, and mitral. While we're here at mitral, I'm going to assess the rate and rhythm. I can listen for a full minute. Rate and rhythm sound fine. And then I'll also go ahead and just do lung sounds while I'm right here. Just take a deep breath for me. We're going to do 6 in the front and 6 in the back. Awesome, and then I'll have you sit up for me. And then we'll get 6 back here too. Just keep taking those deep breaths. You're doing awesome. Sorry, I know it's always gets a little lightheaded when you're doing this many. 2 more. Awesome, go ahead and lay back down. I'm going to look at your abdomen really fast. Have you had any pain in your abdomen? No, perfect. I'll go ahead and try to keep everything covered as much as possible for privacy. I'm going to first just inspect. Everything looks okay. And we'll go ahead and listen to bowel sounds. We'll be listening in 4 quadrants. In each quadrant, I'll be listening for up to 30 seconds. If I don't hear bowel sounds in that time, then we'll go ahead and just report it. But she hasn't had any issues, so it should be fine. Good. 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 And we'll go ahead and listen up here. Perfect. Okay, we'll go ahead and get you covered back up real fast. How have your bowel movements been? Have they been normal for you? Yeah, when was your last one? Perfect. What about your urinary system? Have you been able to urinate okay? Any pain or burning? Nope. Awesome. We're up here. We're going to go ahead and take a look at our arms and our hands. We'll just stick those out for me. While I'm here, I can go ahead and assess the color. I can be looking at my cap refill. I'll be looking for any possible injuries, skin breakdown. I see over here I do have an IV, so I'll go ahead and take note of that. I'll be looking at that, assessing for any redness, discomfort, swelling. Everything looks okay. She says that it doesn't hurt at all. I'll go ahead and keep coming down here. I'm just going to have a look at your legs. We'll cover you back up as soon as I can. Okay, I'm just going to take a look at your legs. I know you've been in some pain. Can you tell me what your pain feels like? And when did it start? Where does it hurt? Your knee. Okay, we'll go ahead and take note of that. How long has it been hurting for? Does anything make it feel better or worse? And do you have any other symptoms, any nausea or anything else with that? No? Okay, perfect. And down here, I can go ahead and check my pedal pulses. Color still looks down here. Go ahead and push down on my feet like you're pushing down on the gas and pull up. Awesome. And still no injuries or anything else down here. While I'm here, I could ask her to take a walk, just make sure that she's ambulating okay. Do you have anything else going on that I need to know about? Any changes? No? Okay, awesome. I don't need to assess her backside right now as she is able to stand up. We're not as worried about any pressure sores or anything else, but we could assess that if it was indicated. I'm going to go ahead and take off my gloves and perform hand hygiene. Okay, Glenda, we're going to be doing a catheter next. I know you had one of these yesterday. Do you have any questions about it? No? Okay. I'll go ahead and raise the bed to a comfortable working height. I know you told me you don't have any allergies, but I'm just going to double check. Do you have any allergies to latex or iodine? No? Awesome. And we'll go ahead and gather our supplies real fast. And I'm going to put on gloves. When I did my baseline assessment, when I checked her eyes, I would have also been checking for accommodation. And then I'm going to lower this down. we'll just put this Chuck's pad underneath you just to keep you nice and clean and dry. I'll just have you help me roll over. Perfect. And to this side. Good job. Straighten that out a little bit. It's a little easier on an actual patient, but we'll make it work. Okay. Make sure you don't fall off here. And then we'll cover you up with a blanket just to maintain some privacy. It's kind of hard to maintain privacy while doing a catheter, but we'll do our best. While I'm doing this, I'm just going to need you to hold as still as you can, okay? I'm going to move this to the side just so I can keep my sterile area. I'm also going to grab my leg here. This is going to be a sterile procedure. So I'm going to make sure I have my garbage right here and everything close so I can keep an eye on my sterile field the whole time. While I'm doing this, make sure not to touch it or do anything else. And then just try to hold as still as possible. It will be uncomfortable, but we're going to try to get through it as fast as we can. We're going to start off just by cleaning the whole area around. We'll be using a different part of the wipe, or a different wipe each time. And then also get around the legs over here. And once everything is all cleaned up, I'm going to go ahead and change out my gloves. And I'll be talking with my patient throughout this whole procedure to provide some comfort, as this can be very uncomfortable. We'll start by opening this away from us. When I'm touching this, I'm only going to be touching the outer 1 inch, as that part is not considered sterile. Start by grabbing my gloves, careful not to touch anything else. And once again, just touching the outer 1 inch. Be careful while doing this just to touch anywhere you're supposed to. I'm going to grab my drape, careful not to let it fall. And I'm just going to put this right in between my patient's legs to create a sterile space underneath. While doing it, be careful not to touch anything. And I'll also be putting this cover just right over it. So be careful while doing candles or anything else. I'll put one of these to the side. We may need it, but we probably will not. While I'm here right now, I'm just going to double check that this bag is closed. It is, so that when I attach it, the urine won't start coming out to the floor, because that would be bad. I'm going to line this up into my hands. I'm going to attach my flush so that I can pump up the balloon. You still doing okay? Yeah? Okay. I'm going to carefully move this over down to here so I can reach it easily. Without letting go, I'm going to go ahead and hold on to the baby, and I'm going to clean it. One side, the way, keeping my hands up. One side, and then this last one will be right down the middle. And then we'll go ahead and get my end that's lubricated. And we're going to insert it at least 2 inches until we see urine. She does not have a hole, so we won't be able to do that, but we'll just talk it through. Once we see urine, we're going to go another 2 inches. We're going to go ahead and fill up our balloon with our 10 cc's. Perfect. And I can pull out just a little bit until I meet resistance. At this point, we can go ahead and take off our sterile gloves. If I mess up and break the sterile field at any point, I would restart. At this point, if needed, I can also get a urine sample. Because I just put it in. If we need any more in the future, we'll have to, we can do it just from the bag right now, but we'll have to use the clamp if we need it again. And then we'll just be cleaning up, and then we'll get you your medication for your pain. Hopefully that wasn't too bad, was it? No? Okay. Go ahead and hang this. And put this to the side, and we'll go ahead and secure it to the leg. Oh, that's right. Be careful when you're moving not to yank this out or anything else. If you have any more pain or discomfort from it, let us know, but it should really help with your discomfort right now. And then we'll hang this on a part of the bed that does not move. Should be right down here, not on his handrail. We gather up all of our supplies. And if we needed to obtain a urine sample, we could, but we don't need to do that right now. This blanket from you. Remove this chest. We can go ahead and change our gloves, perform hand hygiene again. We'll grab your water. And I'll raise your bed for this next part. Is that okay? Yeah. Here. There's your water. Okay. We're going to be coming over here to our MAR system. And it looks like we need to give you some Tylenol. Are you in some pain? Yeah? Okay. Well, hopefully this should help. I'm double checking that there's no allergies. We'll be giving acetaminophen, Tylenol, which is this one. This is 325 milligrams. Here I'm going to be looking at my indications, the action, which is an analgesic by inhibiting the prostaglandin and other substances. Pretty much it'll just block the pain receptors. We'll be looking at adverse reactions, any drug interactions, and contraindications. And I also can look at nursing considerations and patient teaching. I've reviewed all of this. So we'll go ahead and get ready. I can figure out how to close that. I'm going to do my second check. Acetaminophen 325, so we'll be doing 2 of them. While doing this, I'm going to do my 5 rights of the right patient, the right drug, the right dose, the right route, the right time. And then we'll go ahead and prepare our medication right here. This doesn't have a place for me to scan it, so we won't worry about that. Doesn't have a place for me to scan the person or the medication, so normally we'd go ahead and scan this and acetaminophen. Let's try this one more time. I guess we've got it. Okay, and I already double checked their name and date of birth. So with their check, acetaminophen 325, we're giving 650 milligrams, so we'll go ahead and give I'll be careful while doing this not to touch the medication. Before I leave, I'm gonna make sure that all my medication is locked up if I need to log out or anything else. But they're pairing it right here, so we won't worry about that. I'm going to assist her with her medication. Here's your water. Do you want me to put this in your mouth? Put it in her mouth and then giving her water. I'm never gonna just leave the medication on her bedside. Right now I'll be checking for any adverse reactions. She has had this medication several times, but we'll still be just making sure that everything's doing okay. We'll be coming back continually to check on her. I'm going to document everything that I did. And we'll go ahead and raise her bed. And put these side rails. And then you have your call light. Is there anything else I can do for you while I'm here? Nope. Put your hair on your face. Okay. Just call us if you need anything else. Your water's right there. And we should be all set.